actively looking for Weather Kids to help us out with the forecast. To nominate an outstanding student for Weather Kid Wednesday, teachers and other educators can go to foxbaltimore.com or send in your entries to 2000 West 41st Street, Baltimore, 21211. Over to you.
Good morning, everyone. Well, September is Prostate Awareness Month, and I have a special guest who joins me today. Dr. Elman from GBMC joins me, and you know, Doc, women, you know, October is Breast Cancer Awareness Month, and women talk to each other and share ideas and stories, but men, they don't go to the bar and say, hey, tell me about your prostate, right? So being Prostate Awareness Month, what kind of screening is there to get checked out to see if you have prostate cancer?
Sure. So, Jimmy, we usually recommend that guys, once they turn 45, sometime between 45 and 49, undergo their first screening, either exam or test. Exam would be a prostate manual exam with a physician, and a blood test for screening would be a test called PSA.
Which means what?
So PSA stands for prostate-specific antigen, and that's a blood test that all men, we have some level of it in our blood from normal prostate tissue, but sometimes when that level goes up above what you would consider normal, then that might be a sign of prostate cancer.
Gotcha. Now, and I'm told one in 9 men will end up with prostate cancer?
Absolutely. 1 in 9 men in their lifetimes will be diagnosed with prostate cancer. So it's really important to stay vigilant and stay on top of screening.
Okay, well, who's at risk?
Well, pretty much everybody's at risk. You don't necessarily have to have a family history of it, but in particular, African Americans are at a 60% greater risk for some reason over Caucasians.
Now, are there symptoms you get to say, hey, I got prostate cancer?
Right, so some cases people do have symptoms. Men could have some urinary symptoms, maybe blood in the urine or difficulty emptying their bladder, although I want to stress that most of the time when people have difficulty emptying their bladder, most of the time it's not prostate cancer. And I also want to say that sometimes when men have prostate cancer, they don't have any symptoms, and it's just picked up on screening.
So that's the importance of the screening.
Absolutely.
Okay, so let's say you had prostate cancer and you're a survivor, and actually people don't know it. I'm as of October 6th, I'm an 8-year survivor. I did have prostate
Congratulations. Can I shake your hand when you're driving?
You can. And you know what? If I see you out on the street and you got a question for me, I'm willing to talk. Well, I'll go have a beer with you and talk.
Well, that's important. We need more guys to talk about it.
So if you had cancer, do you still have to get screened and be checked out?
Oh, absolutely. We always want to make sure that the cancer doesn't come back. So usually we'd follow with your physician that did your treatment and probably get a PSA test.
All right, well, coming up on Saturday, September 28th, is a very important event. It's the Legacy Chase. Can you tell us a little bit about that?
So Legacy Chase is our biggest annual fundraiser for the Cancer Center here at GBMC. It's a steeplechase. It's a lot of fun. We celebrate our cancer survivors. We're expecting 7,000 people this year.
All right, well, I'll try to make it out there. Men, you know, I know that rectal exam is not comfortable, but man up, hey, it's not like we're giving birth, you know?
Nope.
So women, I'm giving you permission to get on your man's case and get checked out, and please get screened for prostate cancer. Dr. Elman, thanks for being my guest today.
It's a pleasure, Jimmy. Thanks for having me.
Okay, I'll throw it back to you guys.